Good morning, everyone. We are at the Committee of the Whole work session, supporting community through quality public service at Tuesday, September 16th, 2025 at 10:45. A little bit late because we had a lot of good discussion at our public health meeting. So our packet includes the minutes from the previous month and also minutes of the standing committees from Airport Advisory Commission, Budget and Facility Advisory Committee, Highway Advisory Committee. And today we have with us a description and an understanding of paid family medical leave with Allison. Good morning.
Good morning. Is that my cue? Am I going?
Yep.
Okay. All right. I was kind of surprised that I was the only one on the presentation schedule today. That doesn't usually happen. I will still not try to take my dear old sweet time today, given that you've already had a long meeting. So today I wanted to bring forth a legislative impact that will take effect starting the first of the year, January 1st of 2026, which is going to have impacts on our organization, and just wanted to provide you information on what that is and kind of what that looks like as we proceed forth in some of my plans. Really to provide you the information and get your support in how I would like to proceed. So first I put together a PowerPoint. I'll go by notes on my screen while let's see how well I'm coordinated and moving two screens here. Oh, sure, thanks.
Yep.
We always talk about when I teach group fitness classes about the mind-body coordination. Like sometimes it's like the pat your something, rub your something, and this is kind of one of those moments. Okay, so paid family medical leave, Minnesota paid family medical leave, or what I'll often term, because we love acronyms, it's easier, is I'll often call PFML during the presentation, or it might just come out, and it's not specifically listed on here, but that's what I'm referring to. So just some background information. The Minnesota paid leave law, which covers the Minnesota paid family medical leave program, was enacted in May of 2023 and has been updated since, starting in May of 2024. And we'll continue to see updates and improvements leading to implementation of this law. And what it does, it makes paid family and medical leave coverage available to Minnesota workers beginning January 1st of 2026. The law provides job protection and partial wage replacement paid by the state to individuals who take leave for qualifying conditions, such as to bond with a new child or for medical care for themselves and their loved ones. The paid leave program will be funded by premiums made up of contributions from employees and employers. So in the previous slide, it mentioned wage replacement for qualifying leave. So there are kind of buckets of what we're calling covered leave. I first want to mention that the paid leave does cover nearly all of Minnesota employers, regardless of the size or the number of employees. So even an employer of one potentially still need to provide this benefit to their staff. It will cover full-time, part-time, temporary, and even our seasonal workers. So really everyone will be covered under this. So the leave that can be requested covers anything from medical-related leave that could be either for your own healthcare condition, or maybe another family members you're required to assist in taking care of. Each leave, so medical leave, could be requested up to 12 weeks, and that really kind of coincides. 12 weeks is kind of an indicator of like it's following FMLA. That's where kind of the 12 weeks comes in. And then the other outside of medical leave would be instances where someone needs to take family leave. So this could be to bond with a child during the first 12 months of a child's birth or adoption, leave to care for a family member with a health condition, leave because of, say, domestic abuse, sexual assault, or stalking, so kind of like safe leave, and then leave because a family member is on active duty. And that as well, leave could be taken requested up to 12 weeks. But together, under any of those leaves, someone can only take a maximum of 12 weeks of coverage. So you can't take 12 and 12 and say,
20.
I'm requesting 24. It has to be a maximum of 20. What did I say?
12.
12, sorry. Is it only
We
Tuesday?
follow.
It's you follow. There's a lot of numbers. So maximum of 20 weeks.
Allison, I've got a
Yes.
question, if that's okay, Commissioner. The leave because of domestic abuse, sexual assault, or stalking, what qualifies? Like, what information needs to be provided to the employer to qualify for that?
Great question. I was actually reading up on paid family medical leave this morning. There's clearly a lot to the program. From what I see, just overall between medical leave and certain parts of the family leave, is there some type of documentation that will be required? I don't know what that looks like in terms of domestic abuse, assault. I mean, a lot of that is very protected information. And what it looks like is, we don't actually, as the employer, it doesn't appear, like I'm not administering the program. It's up to the state or another option, which I'll talk about later, to actually administer the program on our behalf. So I would anticipate that there's probably some type of documentation that needs to be submitted to that entity, and we would not actually be a recipient of any of that confidential information.
Thank you, that's
Yeah.
helpful.
Yeah. All right, we'll go to funding. So the previous slide said that we mentioned premiums. So there has to be funding for the program. Where are they going to get the money, right? So starting January of 2026, paid leave premiums will be financed through payroll deductions on employee wages and contributions from employers. Employers will contribute a minimum of 50% of the total premium, though they may choose to pay up to 100% of the premium. Employers will be able to deduct the remainder from employee pay up to a maximum of 50% of the premium. So basically, what's written into state statute is that employers need to contribute a minimum of 50% up to 100% of the premiums. So employees would cover the remainder, but it can't be more than 50%. So most of the, it'll either be split 50-50 or more of the burden of paying the premium will be on the employer, is how it's written. And then I used a lot of these charts that were provided by Minnesota Indeed on how this program will work. So they had this little chart. So you have the total premium, and technically the combined premium is actually made up of two separate premiums, one that's considered the premium for the family leave and then one that's the premium for medical leave. And then as you can see, it's just that everything at some point will be potentially split between the employer and the employee.
Do you want to talk about how we get to the percentage? How we decide?
How we decide? Yeah, it's coming up in the next, yep.
Okay.
I'm getting there, Krista.
Sorry.
What I've learned is she's very good at foreseeing what I'm gonna be covering here on my stuff. So, this is a state implemented program, where the information prior says, like, premiums paid to the state will administer this. Well, there's also a caveat to that. And that is called, or it's in regards to equivalent private plans. So employers can choose to provide paid leave benefits through an equivalent plan instead of through the state of Minnesota and their paid leave program. But this plan must offer benefits that are as good or better than those provided by the state. And then there's another caveat that it can't cost the employees more to go to that equivalent plan. And these equivalent private plans, most insurance carriers provide some type of approved equivalent plan that has been pre-approved by the state of Minnesota. So a lot of times, instead of using the term equivalent private plan, we'll do like private administration, a private administrator. So those are all kind of still very similar terms to saying we're going a different route versus using the state of Minnesota to provide this benefit. So, where we're at, and what we've been doing, we, as in myself, working with the Benefits and Wellness Committee, it really comes down to, it sounds like we've got two options. Do we utilize the state of Minnesota to administer this benefit in this program? or do we go the private plan, the equivalent route, the private administration route? So what do we do and how do counties make that decision? So there are different decision factors kind of identified, weighing pros and cons and things to look at when we look at, do we decide to go with the state or the private plan route? So those major decision factors that we've identified are the cost of the premiums, the experience of the organization, the state or the private insurance carrier, their experience in processing paid family medical leave. This is a new benefit by the state of Minnesota. The processing time from when the employee submits the request and the required paperwork to when they receive the benefit, so that's the processing time. How the paid family medical leave integrates with other benefits like short-term disability, long-term disability, kind of thinking about that. And then customer service. Customer service is a huge thing. It's a new benefit. If I don't administer it, who's going to work with employees who may have questions and maybe hit roadblocks potentially in that processing? So to determine which path would be best for Cook County, whether we go the state or the private route, we did conduct an RFP working with Integrity Benefits. So Integrity Benefits we currently work with for our ancillary benefits, dental, vision, short-term disability, life insurance. Basically the only benefit we don't work with them on is our health insurance because that's through our cooperative. So I worked with Isaac Uppus, who is our rep with Integrity Benefits, to work with even the other counties kind of during this big RFP process, because again, all the other counties in Minnesota are going through this. So all of the other counties that currently work with Integrity Benefits went through the same process like towards the end of the summer. And after the RFP and all of the results are organized into a nice little table fashion, we get the information. I've shared it with Benefits and Wellness. We've had a chance to talk about it and look over it. So I took a snapshot of just a little bit of the results. It's more comprehensive. I actually printed this off so I can look at it. So it's multi-pages, but what I did is a snapshot where I'm comparing the state's plan and their structure and those decision factors, those kind of major decision factors, and I'm comparing it to MetLife. Now, why I picked MetLife on here is because this is the identified plan between myself working with Integrity Benefits and the Benefits and Wellness Committee that based on the various decision factors, which we'll talk about here, we determined if we proceed with the private route, the private plan route, that MetLife would be our chosen provider. So I left out all of the other providers that were on our RFP. And I just want to mention those two. We received RFP information from Madison National, who we currently utilize for long-term disability, New York Life, Lincoln Financial, and the Hartford. So if you look at the chart, and I listed out the different decision factors, I just want to talk about each of them. And that will then kind of provide the information on the path that I'm recommending going forward. So with the state of Minnesota and MetLife, kind of the biggest thing that we can put a dollar figure on that's important, right, is what are the budgetary impacts, because we're going to have to pay something on this, is what is the premium rate. The state of Minnesota, they have eventually, after working through the cost, have finally settled on a total premium rate of 0.88%, and that's times by the covered monthly payroll. Covered monthly payroll includes like regular wages, overtime and whatnot, because people are requesting a supplement of their wages, so we have to look at what are people earning and taking it times that premium. So the premium rate for the state of Minnesota, they're saying is 0.88%, at least for the first year, because we don't know what's going to happen afterwards. MetLife is 0.79%. So the calculation below is the total premium per month times our covered monthly payroll that we provided to the organization to make those calculations. So monthly and year, they're broken out. So as you can see with the difference by the slightly less percentage of the premium rate with MetLife, there would actually be a savings of roughly $11,000 per year if we went the route of MetLife. Let's see here. Experience. So this would be the experience with actually processing paid family medical leave requests and working with that program. The state of Minnesota, this is new, so they don't have any experience, right? They're going to be figuring it out just like everybody else. However, MetLife has already established programs and working with the paid family medical leave benefit in other states. So they currently work with over 3,000 other groups with their paid family medical leave benefit, and they were just apparently they don't do spell check in PowerPoint. They were awarded, they were just recently awarded the New Hampshire's, their state plan administration contract. So they will be administering that state's paid family medical leave benefit versus having the state create their own division to process that. Processing time, so again, what is the turnaround for employees submitting the claim, getting their documentation in by the time that they receive benefit? Well, it's kind of unknown for the state of Minnesota. They're gonna have to work out kinks. It's a new program, right? But based on what has been seen in other states implementing the program for the first time, they're estimating the approximate turnaround time could be as much as 60 days. So potentially up to 2 months that an employee has to wait before they're paid their supplemental wages for time that they requested off medical leave or family leave. Versus MetLife, they already have an established process, experience. They're looking at a process and turnaround of 2 business days. Again, that's dependent on making sure that the employee submits all of the proper paperwork. How this benefit integrates with other benefits that would be tied to paid family medical leave. So with the state of Minnesota, they're not going to be processing any of our other benefits. So there's no integration with any other benefits at this time. However, with MetLife, they are an insurance carrier that can provide other benefits. So what I've tended to lean towards is, for efficiency purposes, when we talk in benefits and wellness, kind of umbrella-ing, if that's a term, umbrella-ing benefits under one carrier, as long as that carrier is effective in what they provide, they're a good option for the county. That tends to be a really great route, especially for benefits that will work with one another. So paid family medical leave will actually be kind of it's an option. People don't have to apply for the paid family medical leave benefit. But if they do apply, there could potentially be an option to supplement, because it's only going to be a partial wage replacement, it's not 100% wage replacement, that there potentially could be an option, or if they have short-term disability, to help supplement some of those wages with their short-term disability benefit as well. So because those two benefits will work together, we also did a corresponding RFP with our short-term disability to see what MetLife would offer. And when we got those RFP results back, MetLife is going to provide a really great option that, if not meets or is better than the short-term disability option that we just switched to with the Hartford in 2025. So we're choosing to move to MetLife as well for our short-term disability, just because of the ease of umbrellaing the benefits, and with anticipation of, pending your approval next week, is that by pairing these under one organization, that there'll be more efficiencies in processing those payments as well. And what I also want to mention is the premium rates at the top. So that MetLife premium of 0.79%, that there was kind of a caveat with the RFP that MetLife is willing to lock that lower rate in for 2 years if we move 2 other insurance programs, subsets, to them for coverage in addition to PFML. So short-term disability is one of them. And then we also plan on moving vision as well over to them. So by moving those two subsets over to MetLife, we can lock in that 0.79%, where the state's premium of 0.88 is only guaranteed for a year, and there's anticipation that that will actually increase once they actually start administering the program. Oh, one more. Go back. There we go. Thank you, Kristen. Then the last kind of, I think it's a really big bucket, is the customer service aspect of this benefit. It's new. There's going to be a lot of questions when people start utilizing it. And what does that support look like? Not only for me and HR and supporting our employees and directing them where to go, but what does the support look like from the actual agency or organization that's processing this? You know, is there someone going to be there throughout the whole way? If you have questions, you don't know what this interface looks like, what am I supposed to submit in order to verify that I am requesting this leave? So what this looks like is the state of Minnesota, employees and employers will have to work directly with the state. Just keep in mind, new program, they have hired 300 new employees, they have new systems and new processes in place. There is no dedicated staff to work, say, for Cook County or our employees. They're gonna have to call and hopefully eventually get through to an actual live person. Whereas MetLife, again, they've already have an established program. I'm gonna skip to the second sentence. MetLife will actually have a dedicated service team specifically for employers that are navigating this benefit administration through Integrity Benefits with MetLife. So they actually create dedicated service teams to work with counties and organizations that are implementing this program. And then in terms of maybe what I need for implementation on the employer side of things, Integrity Benefits will be my point of contact, versus if we went with the state, I can't use Integrity Benefits. They're not a part of the process. So there's dedicated customer service with MetLife. There's customer service with the state of Minnesota. It just looks a little different. Okay, next slide. So what, outside of the RFP, I think one of the other questions that comes up is like, what are other counties doing, right? So I have some information for you. Someone in kind of my HR email thread, like HR listserv in the state, started an email thread with like a link to a fillable spreadsheet with, hey, if you can plop in your county's name. It was different information. They also were asking about COLA, you know, just trying to get various information. But then one of the pieces of information that they were collecting was, what are you guys doing for PFML? And so as of like a week ago, this was the information that had been completed and provided on that spreadsheet. So there's only 36 counties that responded. And from what I could make out based on responses, 9 were unknown at that point. They were still kind of working through this process like I am with you all, with their organizations. However, I looked at and kind of broke out and tallied which counties are going with the state of Minnesota versus the private plan. And some said yes, that they've actually gone through this process, have had formal approval by their board, by their county. And others were in that likely state, likely status, which is basically what I said, we're likely to go this route pending all of the other processes in place. So most of the counties are actually going the route of the private plan, and many of them work with Integrity Benefits also and plan on going with MetLife. So what's next? So after sharing this information with you and having a conversation, answering any questions that you may have, I do plan on bringing my request to the board next week to support and approve going the private administrative route for paid family medical leave with MetLife. I would continue to work with Integrity Benefits to proceed through that implementation and setup piece, get all the things in place that we need, policies, procedures, postings, notifications to staff. Education is a huge piece, especially as we're coming up in an open enrollment. A lot of those pieces would be incorporated into our open enrollment process, education, presentations, and whatnot. And then what I've already started doing is reaching out to the bargaining units, because this is going to impact employees in a potential cost sharing of those premiums is that they need to, we need to work with them to land on that final cost share ratio. So I think it was either maybe Monday, yes, it was only yesterday. Between, I think it was the end of last week and yesterday, I've been working on reaching out to the 3 bargaining units and their stewards to just give them a heads up. I was doing this presentation today, and that we're going to have to discuss and negotiate what those cost shares look like, and then basically draft a MOU to the 3 bargaining unit agreements that will cover whatever final decision we come up on. So there's kind of several steps in place, several other steps coming up that we're kind of already actively working on. Thank you. And do you have any questions?
I do. Thank you, Allison.
I'll see what I can answer based on what I already know.
Yeah, so looking at through private insurance, would this be a 2-year contract that we would do, or would it be annual?
So it's set up like other benefits in that we don't necessarily have what we would call a typical contract. Like, we don't bring a contract here to sign. It would be like any of our other benefits. Our health insurance, like, yep, I approve the renewal. You guys don't see, you don't sign anything. So it'd be similar to that, is that there's kind of an underlying agreement contract, but it's not the normal route of any other contract that we do. So if we go with the MetLife plan, then we would be locking in, because to lock in that 0.79%, we're going to move over our short-term disability and vision, which don't need board approval. I just want to say too, because they're 100% employee paid. So a lot of those changes are determined and supported by the Benefits and Wellness Committee. But we determined that that was the best route, not only for those benefits, but then to lock in that lower premium rate. So for 2 years it would we would be locked in, and then going into probably the summer of like a year and a half afterwards, it would be another RFP process, just like any of our other benefits, when we're kind of coming to the end of that like current percentage agreement or premium agreement, that we would do the RFP process again and see where things are at. Potentially it would be the state, going to the state, or maybe MetLife would no longer be the option. So it would be a similar process that we do with any of our other kind of ancillary benefits.
All right, thank you.
Does any of this apply to the commissioners?
No.
Yeah,
It
good
doesn't.
question. I know, I was trying to actually, I'm glad you said that first, because I actually don't think it does.
It doesn't.
Elected officials
Because of
are- No,
eligibility, because the elected officials, which I'll have to double check, because we have other elected officials, but it's a little different with commissioners, because you're not necessarily an employee, you're an elected official. And then also, a lot of the eligibility kind of falls in the same guidelines as unemployment insurance. And so this, the county submits wage detail reports to the state of Minnesota for unemployment insurance. And so it's gonna follow the same lines of, we report the same information. We still have to report to the state even if we use a private administrator. And I don't believe you guys are eligible for unemployment insurance either. So I'm like 95% sure that commissioners are not eligible. But again, there's a lot of statute, legal language to read and to understand as we're still working towards the implementation of the
Just wanted to
of the
clarify
program.
that and
Yeah.
look into it a little bit more.
Yeah.
But I'm really happy that you're going with MetLife. After the fact of my report this morning that the state is abysmally behind in public health updating, I don't have the trust in them, even though it's a new, system and they're hiring all these people. Maybe in 3-4 years, you might look at it and say, hey, they're doing a really good job,
Yep.
and compare it as you go along, but I'm glad you chose MetLife.
Absolutely, and in our conversations with benefits and wellness, there's pros and cons to everything, even when we're not looking at paid family medical leave, like what's the benefit of doing this, what's the benefit of that? And maybe eventually the pros to go with the state of Minnesota will outweigh the pros to go with a private administrator, but it just felt like with those main decision factors, slight cost savings and customer service, the processing turnaround time, people are missing work and if they're requesting a wage supplement, like who's gonna wanna wait 60+ days for that payment? And so we felt at this point that with all of the organizations that responded, that MetLife outweighed any of the other options.
Jean?
I just wanted to respond to Administrator Treble's earlier inquiry that the certification for safety leave, which would sexual assault or domestic abuse, any of the other eligible conditions would fall under that specifically. That can be sought by submission of a court record or somewhat unhelpfully through documentation signed by a qualified person acting in the qualified person's professional capacity. So the commissioner can set rules on that moving forward, and hopefully we'll see that happen proactively. Otherwise, we'll have, I'm sure, denials and then appeals will set the law.
Okay, thank you.
Any other questions or comments? Commissioner Gamble?
Yeah, thank you. Thank you, Allison, for the research going in and informing us as commissioners, decision makers on this. There are, in the United States, there's 16 states that have paid family leave, medical leave, and then the District of Columbia. So that makes 33% of the United States offers this. And I think there's 3 or 4, like Minnesota, that are introducing this going into 2026. If you look at this, this is basically a mandated by legislation requirement. So we talk about unfunded mandates. This is an unfunded mandate. If you look at the 17 entities that have offered this benefit, you will find that there's a variation, and in the mandates, in the legislative language, it'll tell you some are saying it's 100% employees, it's 60-40, you know, the employee and then employer, it's 50-50, it's whatever. So you look at the language in the legislation that is basically telling you what you need to do. And this is true relative to the benefit as to the percentage of your wage that will be paid, and it is also the length of term. Most of these are 12 weeks. Some of them are 12 weeks within a 24-month period, meaning 2 years, but most of them are 12 weeks within a year. So I think understanding the language, which is simply to say, and it is to the question of whether or not commissioners or elected officials, who is covered and who isn't. The other thing is that amongst those 33% of the states, District Columbia, that participate in this, there are those that it is mandatory and there are those that it is voluntary. And so you can look at that and you can see it. You might want to look at it, if I were a legislature, I would look at a comparable with the states that have enacted this, and I would look and say, how many are mandatory and how many make it voluntary? And then I would draft legislation that's reflective of what I learned through that research. In this situation, we have legislation that sets parameters. We have to work within the parameters. So very simply, what I would say is that certainly the 9% is significant when you look at the difference between what the rate is, and in your comparison, you're looking at not only what's the cost, we have a 9% significant drop, predicated on negotiating and including some other things, which is bargaining power that we're already providing, which makes sense, so that's a good strategy. We have a 2-year lock-in. These programs annually are revisited. So based upon whatever's going on in that particular state, they will set that percentage, which initially is being set at 0.88, so that's going to change. We would lock in for 2 years. The other thing is that with Minnesota, and to Commissioner Storley's point, there's not a good track record there when it comes to, we can just look back at getting our driver's license and license plates in the state. It's a system that was convoluted. So I'd rather have a horse that's trained than a horse that's just, out of the barn. And so I would agree with, you know, the recommendation in that regard. Right now, if you look at this, if we went at a 50-50, we're looking at approximately $50,000 impacting our levy. $50,000. So going into the 26 budget, we're looking at 50,000. When I talked to Brady about it, he said he had put in the budget at 75, which is an additional $25,000. My position as a commissioner that I would support would be that if we're mandated, whatever we're mandated, we have to comply based upon mandate. But this is not a funded mandate, therefore, out of respect to the taxpayers, I would support the 50-50, which is allowable under the mandate. Which is looking at for the next 2 years, well, it'll change because depending upon what our pay is, that percentage is taken times whatever that pay is. But we know for sure that we saving at least, you know, $50,000 out of a projected $100,000 annual premium. So.
Absolutely. Thank you for that.
Any other questions or comments? Well, thank you so much. You know, I sat in on a meeting 2.5 years ago, and we had our local business folks, you remember that, out at Devil's Track? They were just astounded at what they have to do. A small business person, what's going to be involved, you know, it's like, well, you know, Susie needs to have 2 weeks off because her mother is ill. We work it out. Now it's mandated how you work it out. So there's been a lot of controversy, but here we are. Us, the county, and businesses, and everybody else. So thank you for presenting that to us. Appreciate it. Getting into a language that we can all appreciate and support and all that. So you'll bring it next week, you
I'll
say?
bring it next
Okay.
week for formal board approval. Request that, going that private route with MetLife.
Yeah, okay. All right, very
Okay,
good.
thank you.
Thank you.
Moving on to item B, upcoming Committee of the Whole agenda topics. Have you all had a chance to think about that? I've had a little chance. Commissioner Sullivan.
Policies and procedures, and I would say policies are an area I would really like to see
Need to
us
stay.
focus on.
Just for a second, it might be helpful.
Other organizations I've been with, and I've stated this previously, have reviewed all of their policies, and like a third of them each year, so that every 3 years we're going through and we're updating and making sure that we are providing those policies that really direct all the work that we do. So I would strongly encourage us to do that.
And we could divide that out for sure and take one at a time and,
Yep.
you know,
Mhm.
every
Commission-
other meeting or every meeting, discuss it.
Commissioner, can we take just one moment to update you on the work we're doing regarding policies and
Sure.
procedures? And I think that aligns with what you just mentioned.
Yeah, absolutely. Like a mind reader too, like Kristen, like what work I'm doing. So yes, Kristen and I have checked in quite a bit recently of like where are we at with policies and procedures. I think a lot of the concerns and things that we've seen going on in the organization and so forth, the investigations have identified the need to update and revamp some of our current policies and procedures, and even identify policies that we don't have, because we can't hold staff accountable if we don't. Not that we need a policy for everything, but we need something on a lot of things written somewhere, right? Because otherwise, how do we hold staff accountable? And if there's discipline needed for something that's not written anywhere, right?
And also to outline expectations so
Outline
that we're clear
expectations.
what's expected of people in their work.
Right. So what I've started to do, and I was working on this even before I came up here, is I am trying to figure the right word. I'm trying to inventory all of the policies that we have. And not that I need to necessarily do policies that don't affect personnel, but anything that is tied to personnel requirements, personnel expectations, personnel safety, personnel discipline, anything, even departmental level policies that I need to be aware of that impacts staff, I'm trying to inventory. And trying to inventory what is the name of that policy, when was it last approved or even updated. I mean, some of these things go back into the early 2000s. I think there was one that the date was listed as like 1980 something. You know, who's responsible for that policy? Just because it says policy doesn't mean that HR is responsible for it. What's the approval process for those policies? We've got different committees, so what is the route of updating and approving those things? And then what I started doing is through my resources as an HR director, more so like the resources through collaboration with AMC and DDA to provide HR training, HR professional training, is that they have some example, they have actually a pretty comprehensive policy and procedures manual, personnel policy manual. And so I've actually been going through and comparing kind of what we have, what I've been able to kind of round up that we have with what AMC has and recommends, and then also comparing it when Rena was in the interim director position, we started revamping the telework policy, and we were referencing the Minnesota MMB website, so basically it's states level HR policies and procedures. And so it's not pretty, but I've actively been, and this is where a touch screen would be nice, because I keep touching your screen. This is where, okay, down. I've been, again, it's not pretty, it's in its rough stages, but I've been inventorying all the policies that I've identified, the last approval date, and then comparing to what AMC has, comparing it to what MMB has, and then identifying where our gaps are, where I haven't located. So code of conduct or respectful workplace policy, some of those things that we don't have, or if we do, we can't locate them. So trying to at least get an idea of what we have, what we don't have, and then how to proceed forth. And that is also one of the reasons behind canceling the personnel committee this afternoon, is because I would like to be really thoughtful and planful in those meetings that we have. And I know a big topic that everything kind of filters down to is what is the policy or procedure on that. So that is what I've been currently doing and will continue to work on. And then we'll work on identifying, what are the next steps? What policies are we identifying that are high priority, extremely outdated, and so forth. So it'll be a long process going forth, but starting that.
So I think once we have kind of the outlined inventory, like she said, then we can bring something forward to the committee of the whole and kind of outline where we're at. So then we can communicate our plan moving forward, get feedback from all of you on if that aligns with what you would like to see and how you want us to proceed.
Great.
So
That's a good
perfect.
start.
Yeah,
Thank you.
Absolutely.
I've got some big thoughts that we've talked about. Yeah, we'll get there.
Commissioner Gamble?
Yeah, thank you, Madam Chair. I appreciate launching into this. It's creating structure, and creating structure that's well-defined, and then everybody can work within the structure. Part of it is in your evaluation and looking at what our policies exist. I think stepping back farther is looking at what we do. So what is our roles and responsibilities within the county, and then where are these roles and responsibilities best defined by policy? So in my first term, when we're looking at sending out requests for proposals for contracts or whatever, if we don't have a best practices or a policy that defines how we negotiate contracts, that makes us vulnerable. So my recommendation is, if we don't have a policy, get a policy that we like and go by it until we get one, because we're missing things because we don't have a policy. And so the big step back is, what all do we do, and what is best defined by policy? And then prioritize and work on those policies where we find ourselves to be most vulnerable.
Yeah, and if I can make one comment to that, that's in part why Allison is leveraging the AMC resources that have been provided, because I think
Yeah.
some of that work has already been done through
No,
that
I would agree with that.
association.
The
Yeah.
other comment when it was initially stated was that we need to do this on our own. And so what my personal opinion on it is that we don't need to hire a consultant to tell us what our policy should be. We use our resourcefulness, we own this, we understand it, we go through it, and we'll be stronger because of that, so, yeah.
Yep.
So I appreciate your work on that. Yeah.
Another area I thought would be some updating on VRBOs within the next couple months. I'm working with Andrew and Mike Keyport on a project, and if the project is kind of going forth, we could have it next month or maybe
Thank you.
the month after that.
Okay.
So that's another updating.
Okay.
Anything else? So, yes.
Yeah, thank you, Madam Chair. So, it mentioned this, when I was privileged to step into the position again here, and that is evaluate boards and committees that commissioners attend. In other words, we should step back and do that. And I think we should develop a policy or criteria that measures and is able to identify, is this something that contributes value to our community? And we've had this discussion, and some of them, I'm sure that you've sat on and say, if we find that it becomes a show and tell, there's a way that we can disseminate information without having to involve time. And it's not addressing self-importance, it's addressing prioritizing the time that we have so that we're, communicating effectively on the areas that, and in the building committee, which we just had.
Mm-hmm.
At the time, we had a lot of things going. We needed to communicate on a frequent basis, and it was important. But you don't want to let that rhythm continue if it's not continuing to be valued relative importance. So relative to evaluating board committees, commissioners attend, develop, and identify criteria to be used in determining value to the community and participating in these boards and committees. Another one is, revisiting, and part of this is me coming into this. We had brief discussion, Commissioner Sullivan, relative to develop a non-mandated funding request policy.
Discretionary fund.
Yep.
And another one is develop a more disciplined, evidence-based budget process. And I can send these to you, but.
Okay.
And then another would be distinguish mandated staffing service requirement specifics to state and federal. So in other words, when we look at the services that we provide, let's find out where legislation, either at the state or federal level, has said this is important enough, we're mandating this, as opposed to what we create in response to our evaluation. So I think when we're looking at staffing, we need to at least know what's mandated. It'd be similar to our discussion relative to the family medical leave. What's mandated? Know that, and then whatever you want to do beyond that.
Yeah.
I think that's important. And it was one of the things coming in public health services that I wanted to look at. What's mandated here? Because it seemed like we got a lot of people.
So we have, I just received, I can't remember if it was from the Minnesota Association or the National Association, a spreadsheet of all of the mandated services for PHHS on the broad level, and I provided that to Plowman, who was very excited about it. So I anticipate that's something that we could perhaps use in the future to bring that information
I think
forward.
that's good, and I think
Okay.
it's good for us as commissioners to
That's good to hear.
understand that. In other words, the context, oftentimes when we're looking at budgets or decisions, say to Brady or our attorney, I just say, what's the context in which this decision can be discussed and decided on? Because we can't just do what we feel like, because there are parameters in many regards.
Okay.
And another one is, excuse me, the hiring process. Who's involved? What's the criteria we lay out, and what's the process?
Okay.
I think in regards to the committees and the boards, we would probably want to have some background on that by January, because that is what we do right away. The very first week of January, we meet and only talk about our boards and commissions. that we're involved in. Some are subtracted, some are added.
Okay.
As we'll find out about Taconite Harbor, and so forth. So
Okay.
if there are going to be some guidelines, yeah.
That's helpful. And I can share on that particular item, Jana, and I will be working on collecting all of, similar to the policies and procedures, trying to get an inventory first, because we have, as you know, many committees, work groups, that we need to first collect, figure out what's mandated, what by statute do we have to have, and then, to your point, what is the value added, where are the connection points with other committees, where's the overlap, and then bring that assessment forward to all of you for approval, so.
And the other thing is, if it's defined, whether we're ex officio in those positions or
Okay.
not, is important. And if we have a voting position in it, then it obviously,
Okay.
that's adds a criteria element that's important.
Perfect, okay. So we can work on that. I have a couple that I wanted to just run past you, if that's okay. As you know, I've been meeting with each department director as well as other staff within each one of the teams, and I've had some questions about, should I be bringing forward information about the services I provide? So for example, veteran services. I don't believe they've been before the board for many years. And so I just wanted to, my recommendation would be that we engage people on an annual calendar basis, and make sure that you're getting information from each one of the departments, but I wanted to bring it before all of you and see if you have interest in presentations from veteran services. Public health is another area that I was meeting with Grace, our supervisor, who I don't believe has given kind of an overall comprehensive presentation about all of the services within public health in quite some time. So just curious if things like that are of interest to you.
Very much so.
Okay.
Yeah.
Okay.
In my
Perfect.
response to it, I would agree. I think expectation, in other words, what's important to us, a presentation can get made, but if there's some criteria that we identify, these are specific elements we would like to know as it relates to this, I think it'd be good to give them an expectation as to what that benefit would be when we meet, as opposed to just saying, hey, come and tell your story.
Do you have any criteria that come to mind?
Well, I think that identifying the nature of the service that you provide, and here again, what is mandated that you have to comply
Okay.
with, and what have we done because of what we believe is unique to our community, and so we've done these things. Here's some of the things that we've done to be resourceful when it comes to the funding. You could look at the highway department, and we see definitely significant change in the highway department when it comes to the funding that enables, things for us in this community that we didn't have before because we didn't have the funding. So when we see that the grant, what percentage is grant funded, what percentage is levy funded? If you were to bring in recycling to me, and I found out how much is coming through grant monies or is provided, by state or federal revenues, and how much falls on the, the levy, those kinds of things which involve service, finances, resourcefulness, and how we distribute roles and responsibility with our staff. In some of the cases, they might come in and say, we have this here, but we found that we could work it this way, so that shows resourcefulness.
Okay.
Yeah.
Okay.
I mean, I could probably think of a few, other things that.
I think MIS, emergency communications, it's the jargon, I can keep up with them, but I can't accurately or well repeat what they're saying. But we've got Jay and we've got Rowan, who are very well respected. This is my observation from the meetings that I go to. And across the upper part of the state, in our region and beyond, for the information that they have. They said on other committees, but for the community to get an opportunity to hear how communications is covered across the board in this county is phenomenal. And we are actually ahead of the curve on that as far as emergency services communications goes. And this would best be presented by those two guys,
Okay,
or one or the other.
okay.
I think we have like a year's full.
I have one
And
more.
there's also things that come up almost immediately, so that administrator has to put it on the agenda.
Correct.
So, you know,
Correct.
we need to have some space for that.
Yes.
One thought I have, if it's okay, is also too, like for presentations by department heads, do you want these at a committee of the whole, or do you want them as part of a board meeting? Because I think sometimes they've been a little bit of both.
I guess
And again,
it-
too, sometimes requests come up for the committee of the whole, and when does it make the most sense, or, what, yeah.
But that could be something that's defined too, in intent relative to the committee of the whole.
Yeah.
And I think, just off the surface, that the committee of the whole is, we can chew on some of these things before we swallow it.
Exactly.
And so that's,
Yeah.
you know, and so you'd say, well, where are we at in the process? What I personally don't appreciate is I don't appreciate finding out about something at a decision-making point and having the urgency that it has to happen, unless it's something that, for us, whatever. But a lot of times, processes have been used as a strategy to bring it in and let time drive the decision, which is not what we want. We'd like to have it come through the process of chewing before we swallow.
That makes sense. And I think the only other reason why I mentioned that is because I know that the time for the committee of the whole is precious, again, I think it's intended to be a time for you guys to get information about something that you'll have to make a decision about in the future. So maybe also consider when a department head would like to make a presentation for information only, or even an outside entity, like say the Forest Service, or something like that, would like to make a presentation, just sharing about something that there's no critical decision that is coming up soon, but they just want to share, like, hey, these are things that are going on. Is that something that you would like to have happen during a committee of the whole or at a board meeting?
And I think that's an excellent point, because we don't get to talk. We've had presenters here with something we should talk about, and there was never any time to talk about it. And so, like with MIS, it could be a regular meeting. More people tune in at some point in the day or week to the regular meeting than they do to the committee of the whole.
The
I
other
have
thing,
no statistics to back that up, but that's just a thought.
So I just wanted to bring that up for thought.
But then all the department heads, like, what do they do in no, I can't even think of the name of the department. In every department, what are you doing during the course of the day? Staring at your computer screens. Just give yourself what do you do? We're excited about what you do. Let the public know what you do.
and I think that's what
Right.
you brought up.
Yeah.
And we're just saying, let's have the criteria so it's
Correct.
it's substantive. The other thing, I think, and the role as far as, thank you, the county administrator, but anybody, is to say there's something we see on the radar or something, whatever, that it's better for us to get up to speed or to have a heads up. And when those things come up, I think it'd be good if we brought it before in the committee of a whole, so that we don't find out, we should have been on this a little earlier.
Yeah, so one of the things that I've used in past roles is identifying what's an informational item, what's a discussion item, and what's a decision item.
Yeah.
And then creating a criteria
Yeah.
to determine, should it go to the full board meeting, should it go to committee of the whole, should it go somewhere else, should it go to one of our other committees first? So I think as we do this overall committee structure, that's something that we can see if we can kind of weave into that process too.
Yeah.
The other thing I was going to mention is when we look at having the different departments come and present to the board, I can start working on a plan for 2026 on what that would look like on an annual basis. But
Yeah.
between now and then, prioritizing the departments that haven't been before the board in several years, I think might be a good place to start if you approve that
Yeah.
or agree with that approach.
Yeah, the other
Okay.
component of that evaluation that you just went through is the time component. sometimes that time component sort of brings priority to those others so that time element is important.
Yep.
The other thing I would say, given that you've been tasked with putting together a plan for us on the budget, so that we would be able to do that certainly would take precedent, but could overlap somewhat with the departmental, da-da-da-da-da. But I think
Okay.
that the budget thing speaks to the timing issue.
Yeah.
So if we look at it in the context of that priority meeting the other objective, that would be good.
Okay. All right.
Okay.
Oh, I was gonna say, the strategic plan, financial management plan, and capital improvement plan.
Mhm.
We need to be updated and fresh on all three of those. We have $900,000 in bond payments due this year, and very significant driver of the levy, and we're not through the capital improvement plan. We're into it,
Okay.
and there is a timeline that they had presented, and we had accepted. So
Okay.
And the other thing that we get when we go to AMC or other, venues that we're participating in, we hear the buzz, we hear what people are talking about, and oftentimes we'll sit down, what are you looking at in your county that's primary? And it might be the waste management issue is a big issue, or there's legislation coming down the pike, and so that awareness then informs where we prioritize some things to help inform us as decision makers, so.
Okay.
Okay, well,
Thank you.
you were
That's
taking
helpful.
notes, I noticed. I was too, so we'll put it all together next month, start digging into a topic. Okay. There be no other further business. We are adjourned. Thank you for your time.
Thank you.
Wonderful presentation by 4 different.
I'm going to be busy.
Yeah.
you're not already?